for joining today's special topic webinar, Lupus 101. My name is Carla. I am the Director of Education at NeedyMeds, and before we kick off today's presentation, I want to go over just a few housekeeping tips. If you have any questions throughout the webinar, you can feel free to type them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have time to answer your specific question, please know we will follow up with you personally via email after the webinar by tomorrow afternoon. But of course, we'll provide the contact information for the Lupus Foundation organization as well as NeedyMeds. And another little tip is that this webinar is being recorded, and what we'll do is we'll convert it into a video and post it onto the NeedyMeds YouTube page. I'll do a little plug about the NeedyMeds YouTube channel. You can find that on the top right hand of the NeedyMeds homepage. You'll see a bunch of social media icons, and the red icon indicates that it's the hyperlink for YouTube. I recommend checking it out and even subscribing, because we do record all of our special topic webinars. So it's a great resource for you to have and to share with your colleagues, your patients, or your loved ones. Also, in the handout section of your GoToWebinar control panel, you will find copies of both the PowerPoint presentation I'm using, but more importantly, the PowerPoint presentation that our guest host will be using to walk us through today's special topic webinar, Lupus 101. So with that, let's go ahead and get started. For those of you that are not familiar with NeedyMeds, this slide lets you know what our mission statement is and how we achieve that mission. We are a national nonprofit, and our goal is to connect people to programs free and anonymously through our website or toll-free helpline that will help them save on or afford their health care. And as you can see, a really crucial part of our mission, as indicated because it's in our mission statement, which is that we are dedicated to educating and empowering those seeking affordable health care. Education is a big part of what we do. And we really define education here at NeedyMeds in two ways. One, certainly by educating people about NeedyMeds and the resources we have to offer, but also by educating on our users about other ways to stay healthy, which is why we are so pleased to have our guest from the Lupus Foundation of America here with us today, Ashley Holden. So first, let me tell you a little bit about the Lupus Foundation of America. This national nonprofit is devoted to solving the mystery of lupus, one of the world's cruelest, most unpredictable, and devastating diseases, while giving caring support to those who suffer from its brutal impact. Now, let me tell you a little bit about our guest host. Ashley Holden is a health educator at the Lupus Foundation of America. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. She has a master's of education and has almost a decade of experience working in community health and health insurance and the health insurance industry combined. So with that impressive resume, you can see why we are so thrilled to have Ashley sharing her expertise with the NeedyMeds audience. So without further ado, and I'm just flipping through this PowerPoint slide, I always put a snapshot of the NeedyMeds homepage. And you can see at the top right-hand side, there's that red icon that I was referring to earlier for our YouTube channel. So without further ado, I'm going to hopefully seamlessly pass the mic and the screen to Ashley. So bear with me just a moment while I do so. And then, Ashley, when you're ready, you can go ahead and grab the screen and begin your presentation. Thanks, everybody, for your patience. And a reminder, as Ashley is walking us through her PowerPoint and the presentation, you can feel free to ask any questions you may have by typing them in the questions section of your GoToWebinar control panel. Enjoy the presentation. Go ahead, Ashley.
Thanks so much for the warm welcome. I'm really excited to be here today and give you guys a little overview of lupus and some information about the Lupus Foundation of America. So again, I really would like to spend some time going over the Lupus Foundation of America, or the LFA, and the resources that we have to offer, and then giving a brief overview of lupus. So a little about the Lupus Foundation of America. Carla did a great job giving what our vision is at the LFA. But to add on to that, our mission at the Lupus Foundation of America is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. So here, you can see, I know there's a lot going on here, but our patient-first research approach delivers better results to improve quality of life. Over the last 40 years, we have contributed to every major breakthrough in lupus research. We've fought and secured public and private funding for new lupus research and treatment. So just a few things on here. We've really helped to set the national childhood research agenda through different partnerships, securing $90 million for lupus research and education. And then a really big one here is an investment of $3.8 million in stem cells. We really think that there's a lot to be said in that research arena for lupus. I don't know if you know this, but a little tidbit, today is May 1st, and May kicks off Lupus Awareness Month. Lupus awareness is important because the public has really knows very little about lupus. Nearly 2/3 of the public knows little or nothing about the disease beyond the name. A little about what's happening for Lupus Awareness Month. May 2nd is PJ Day. For most of us, a PJ Day sounds like a luxury, but for those with lupus, it is too often a necessity due to their disease. PJ Day is a great way to honor and support the many people with lupus and also consider raising funds for the cause. There's also May 10th. This is World Lupus Day. You can participate in World Lupus Day by bringing greater attention and resources to the efforts being made to end the suffering caused by lupus. Urge people in your community to join efforts to raise awareness of lupus and urge your government officials to do more to help find cures for this disease. And then also May 18th is Put on Purple Day. Wear purple and raise awareness about lupus. Joining activities tied to Put on Purple Day is an easy way to expand awareness, raise funds for lupus research, and show support for those living with the disease. If you're interested in learning more about the Lupus Awareness Month, you can visit www.lupusawarenessmonth.org. So what resources are available through the LFA? The first resource I'd like to spend some time talking about is the National Resource Center on Lupus, or the NRCL. You can access this at resources.lupus.org. This is a one-stop shop to find all of the up-to-date resources and information on lupus. The NRCL has information for those that might have lupus, newly diagnosed, or even those that have had lupus for several years can find helpful resources. The NRCL also has information for caregivers and health professionals. Another great LFA resource are the health educators, such as myself. Whether you have been living with lupus for 10 years, have been newly diagnosed, or a caregiver, our trained health educators are here to answer all of your questions about lupus. In some cases, the health educators may be able to help you find resources to help manage your lupus, such as locating a prescription assistance program. Health educators generally try to answer questions within 48 business hours, but keep in mind, sometimes it may take longer for a response during peak times, such as Lupus Awareness Month. There are quite a few other ways that we can help and get involved and get answers and support. So the first one is, we talked about the National Resource Center on Lupus, the National Health Educator Network. The next one here is the Center for Clinical Trials Education. And for many people with lupus, participating in a clinical trial is empowering, giving them a way to belong to a larger team focusing on their particular health concerns and ensuring them of a thorough evaluation by a highly qualified team of health professionals with particular expertise in lupus. If you're considering participating in a clinical trial, this is where you can find the answers to all of your questions. You can also search a database of clinical trials in your community and sign up to receive announcements. And up here you can see that the website for Finding information about clinical trials is lupus.org/clinical-trials. Research for Me is an online data collection tool where you can share experiences about the disease. By sharing your story, you're playing an important role in accelerating lupus research and treatment. Again, this is available at resources.lupus.org/registry. We also have local support and programs. This is an opportunity for you to get involved locally with our chapters in regions across the country who provide numerous fundraising and education events and support programs. You can search for the chapter or office near you on our website. The Expert Series is an educational video series that features monthly presentations with a focus on helping you to live well with lupus. Segments are available every third Thursday of the month. Topics include how to manage and prevent flares, financing your medical care, managing medication side effects, and diet in lupus. Some upcoming topics to look out for include lupus and brain fog and men in lupus. The last one up here is the Take Charge series. This is going to be launching this spring. It's our new education series designed to help individuals take charge of their lupus. Over the course of 8 weeks, people with lupus will receive a weekly email from our health educators with a self-management tips and resources to empower them with knowledge and skills to better manage their lupus. So when we look at ways to get involved and stay connected, we have different walks. So you can walk to End Lupus Now. These events are conducted nationwide to raise money for lupus research, increase awareness of lupus, and rally public support for those who suffer from its brutal impact. Walks are held nationwide in various locations. You can also become an advocate. We need you to join us in making your voice heard on Capitol Hill about the need for funding to support critical lupus research and education programs. It's also important that your members of Congress hear from you about the impact of lupus and the issues that are important to people with lupus. We also host an annual advocacy summit in Washington, D.C., which is an opportunity for you to meet with your members of Congress. Again, this is something that you can sign up for on our website, lupus.org. Make Your Mark is our community fundraising program. We provide you all the tools and resources you need to host an event and fundraise in your community. You can get creative. The sky is the limit. People host everything from bake sales to fashion shows in their communities. Again, you can go to lupus.org to find more information about this. We also need people to share their stories. We really want to showcase how lupus changes people's lives and the impact it has on our friends, family, and communities. We are always looking for stories to feature in our monthly newsletters, be available for media interviews, or share their experiences with legislators. Again, this is something that you can sign up for by visiting lupus.org. And we also have an e-newsletter. This is something I encourage you to sign up for, as you can get the latest research news as well as articles about coping and living with lupus. The last resource that I'd like to talk a little bit about today is Lupus Connect. Lupus Connect is an online lupus community where individuals with lupus and their loved ones can engage with others like them from around the globe 24/7 to share experiences, find emotional support, and discuss practical insights for coping with the daily challenges of the disease. Lupus Connect can be accessed at lupusconnect.inspire.com. People affected by lupus have told us repeatedly that they would like a place to connect online with others like them. As you can see here, there are a variety of challenges and considerations when it comes to living with lupus. Based on all of these factors, we really wanted an online platform that encourages its community members to ask questions, reply to posts, and read about others' experiences in a safe and comforting community. So what is lupus? Normally, our immune system works to keep us healthy against bacteria and viruses like the flu. In an autoimmune disease like lupus, The body cannot tell the difference between those invaders and the body's healthy tissue. The body ends up attacking its own normal tissue, causing inflammation, pain, and damage. It's important to remember that, unfortunately, there is no cure for lupus. Lupus is different for everyone and can range from mild to life-threatening. Lupus is a disease of flares, or when symptoms increase, and remission, which is when the disease becomes inactive, usually with the help of medication. Lupus is not contagious or something you can catch. It is also not related to HIV or cancer. A lot of people want to know what the future holds when they're diagnosed with lupus. The prognosis of lupus is better today than ever before. With close follow-up and treatment, 80 to 90% of people with lupus can expect to live a normal lifespan. Causes of death among people with lupus include heart attacks and cardiovascular diseases. Serious infections, often related to the immunosuppressive medications used to treat it, may also occasionally be fatal. There are 4 different types of lupus. I would like to spend some time going through each of these and giving you a bit more information about each one. So first we have systemic lupus erythematosus, or SLE. This is commonly what people refer to as lupus. This is the most common form of lupus, and again, this is where the immune system is overactive and can range from mild to severe. It can also involve multiple organ systems in the body. So lupus can affect almost any part of the body. I know there's a lot on this diagram. I'd like to go through a few of them for today. We'll talk about cutaneous or skin lupus in just a little bit, but common things you'll see with the skin are the butterfly rash, fasciitis, which is the inflammation in blood vessel walls that can cause fatigue, pain, and fever. Raynaud's disease is where the blood flow in the hands and feet are restricted, and the tips of the toes or the tips of the fingers can turn red, white, blue, or purple. This is usually triggered by stress or cold temperatures. If we go over to the bottom left-hand side, there's the blood there. So some of the things with the blood that can happen with lupus are thrombocytopenia. This is low platelets in the blood. It may lead to nosebleeds or bleeding gums. May also have fatigue, general weakness, skin discoloration that can look like red dots or purple tinged rash. Also leukopenia, which is low white blood cells. So if there's low white blood cells, you could show signs of infection or get infections much easier. Circulating autoantibodies and immune complexes mean an increased number of autoantibodies in the blood. Switching back over on the right-hand side, we have musculoskeletal. So people with lupus often experience muscular, tendon, and joint pain. Some common ways lupus affects the musculoskeletal system are inflammation, which is the most common reason for muscle pain and aches. Lupus arthritis can cause pain, stiffness, swelling, and tenderness, and warmth in the joints. Lupus can also cause inflammation in the muscle that causes weakness and loss of strength. We also have the reproductive side, kind of opposite of the musculoskeletal on this diagram. So lupus can cause pregnancy complications, an increased number of miscarriages, risk of blood clots, and also irregular periods. Gastrointestinal, so people with lupus can experience problems in any area of the gastrointestinal system. And so that could be nausea, vomiting, diarrhea, weight changes, among some other things. Looking at the liver and kidneys, cell paths are blood cells spilled in the urine during a urine test. Edema is swelling, sometimes in areas such as the legs, but also can happen in the wrists or arms or joints. Moving up to the heart and lungs. Heart disease is a leading cause of complication in lupus patients, detectable by different symptoms that include shortness of breath, swelling, chills, fatigue, coughing, fever, blood pressure, and even an examination by your doctor. Many of the things listed here are related to inflammation of the heart and lung membranes and heart muscle. And finally, the last one that I'd like to talk about is the nervous system. So this is going to include lupus fog and memory problems, vision problems, strokes, facial pain, muscle dysfunction, lupus headaches, which are similar to migraine, Raynaud's that I mentioned earlier, tingling, and even mood swings. So as you can see, lupus really impacts almost every system of the body. And this is just a brief overview of some of the complications that can occur and how lupus can affect the body. The next type of lupus that I'd like to talk about is cutaneous lupus. So cutaneous can also be called skin lupus. Skin lupus can be related to systemic lupus, or you may just have cutaneous lupus. In fact, about 66% of people with systemic lupus will have impact on the skin. Even if the diagnosis is cutaneous lupus and no other organs are involved, like there would be with systemic lupus, there's still about a 10% chance that cutaneous lupus could become systemic. There are three major subsets of cutaneous lupus: chronic cutaneous or discoid lupus, subacute cutaneous lupus, and acute cutaneous lupus. Looking at discoid lupus, that appears as disc-shaped round lesions. The sores usually appear on the scalp and face, but sometimes they will occur on other parts of the body as well. Discoid lupus lesions are often red, scaly, and thick. Usually they do not hurt or itch, and over time these lesions can produce scarring and skin discoloration. Subacute cutaneous lesions may appear as areas of red, scaly skin with distinct edges or as red, ring-shaped lesions. The lesions occur most commonly on sun-exposed areas of the arms, shoulders, neck, and body. Acute cutaneous lupus lesions occur when systemic lupus is active. The most typical form of acute cutaneous lupus is the malar rash, flattened areas of red skin on the face that resemble a sunburn. When the rash appears on both cheeks and across the bridge of the nose in the shape of a butterfly, it is known as the butterfly rash. Perhaps this may be one of the most recognizable symptoms of lupus. However, the rash can also appear on arms, legs, and body. These lesions tend to be very photosensitive or sensitive to UV rays and light. So here are just some picture examples of what these different forms of cutaneous lupus may look like. Another type of lupus is neonatal lupus. Neonatal lupus is not true lupus. It's a rare condition associated with certain lupus antibodies from the mother that affect the fetus. At birth, the baby may have a skin rash, liver problems, or low blood cell counts, but these symptoms typically disappear completely after 6 months with no lasting effects. One complication infants can have from being born to a mother with lupus is congenital heart block, which will need treatment by pacemaker. However, this is very rare. And finally, let's take a look at drug-induced lupus. Drug-induced lupus is a lupus-like disease caused by certain prescription drugs. There are at least 46 medications that can cause drug-induced lupus. There are 3 listed here that are the most commonly connected with drug-induced lupus. They're used for treating blood pressure, an irregular heart rhythm, and tuberculosis. It usually takes several months or even years of continuous therapy with the medication before symptoms will appear. While the symptoms of drug-induced lupus are similar to those of systemic lupus, only rarely will any major organs be affected. The lupus-like symptoms will usually disappear within 6 months after these medications are stopped. Of course, if someone experiences drug-induced lupus because of one of these medications, then that medication should be avoided in the future, and they should talk to their healthcare provider about other options or alternatives available. So let's take a look at what causes lupus. Many, but not all, scientists believe that lupus develops in response to a combination of factors both inside and outside the body, including hormones, genetics, and environment. While the exact cause or causes of lupus are not fully known, it's widely accepted that lupus results from a complex interaction of genes and environmental factors. Environmental factors such as hormonal and occupational exposures, ultraviolet light, mental and physical stress, infectious agents, chemical and toxins, and certain drugs are also known to trigger the onset of lupus. So who gets lupus? When we look at gender, women are approximately 10 times more likely than men to have lupus. Lupus strikes mostly women in childbearing years. Hispanic and Black women are 2 to 3 times more likely to develop lupus. And relatives of people with lupus have a 20% chance of developing it. But 5% of children will develop lupus if their mother has it. Here we have a list of common symptoms of lupus, and you can see there's a pretty long list. So extreme fatigue or tiredness, headaches, having painful or swollen joints, fever, anemia, swelling in the feet, legs, hands, or around the eyes. So that edema that I talked about a little bit earlier. Pain in the chest upon deep breathing, that butterfly-shaped rash across the cheeks and the bridge of the nose. Sun or light sensitivity, that's also known as photosensitivity. Having hair loss, abnormal blood clotting, Raynaud's phenomenon, mouth or nose ulcers. So you're probably wondering how lupus is diagnosed now that we've gone over all these impacts of this disease. Well, it's very important to understand how lupus is diagnosed. Typically, your doctor will review your current symptoms, do a physical examination, which may include blood and urine tests, or possibly a referral to a specialist such as a rheumatologist. The doctor will also want to know about any family members with a medical history of autoimmune diseases. Your doctor will also take a look at your medical history and any symptoms that you've had in the past. And the biggest thing with lupus is there is no single diagnostic test for lupus. The doctor will use a variety of tests to help them see a big picture of what's going on. And depending on the type of lupus or suspected organ involvement, the doctor may also want to do a tissue biopsy. So lupus is a disease that's known for being difficult to diagnose because the symptoms are different from person to person. They can come and go, and they mimic the symptoms of many other diseases, such as rheumatoid arthritis, blood disorders, fibromyalgia, diabetes, thyroid problems, Lyme's disease, and a number of heart, lung, muscle, and bone diseases. It can sometimes take several years for a person to receive an official diagnosis. In many cases, the best treatment approach is with a healthcare team that will tailor treatment to your specific condition. Today, top doctors treat lupus using a wide variety of medications, ranging in strength from mild to extremely strong. Prescribed medications will usually change during a person's lifetime with lupus. However, it can take months, sometimes years, before a healthcare team finds just the right combination of medicines to keep lupus symptoms under control for a patient. There are many categories of drugs used to treat lupus. However, the FDA, or the U.S. Food and Drug Administration, has approved only a few specifically for lupus, which include antimalarials like Plaquenil, steroids like prednisone, and then Benlysta. Benlysta is the first and only drug specifically developed and approved to treat lupus, and then aspirin. Many other medications are used off-label to treat the symptoms of lupus, such as non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen. There are also immune suppressive drugs that will be used, like cytotoxin, Imuron. We also have blood thinners that can be used as well. Once someone's been diagnosed with lupus, the doctor will develop a treatment plan based on age, symptoms, general health, and lifestyle. The goals of any treatment plan are to reduce inflammation caused by lupus, suppress the overactive immune system, prevent flares and treat them when they occur, control symptoms like joint pain and fatigue, and also to minimize damage to organs. Lifestyle considerations should also be taken into account. So fatigue may trigger flares. So people with lupus are encouraged to get plenty of rest. Physical activity is important to do within each person's ability as well. A nutritious, well-balanced, and varied diet that contains plenty of fresh fruits and vegetables, whole grains, and moderate amounts of lean meat, poultry, and fish is recommended. Smoking increases the risk for many things, including heart disease and blood clots. If someone smokes and has lupus, it's important for them to find a program to help them quit. People with lupus are at an increased risk for infection, so vaccines are very important. Good news is that the common flu shot is usually inactive and not live, as someone with lupus should not be getting a live vaccine. Also, there are 2 different pneumonia vaccines, both inactive. Lupus patients are at an increased risk of pneumonitis and lung infections and might want to consult their doctor about getting the pneumonia vaccine. In addition to medications or other medical care from doctors, a large and growing number of people turn to other healing practices to try and improve their health. Before beginning any complementary or alternative therapy, it's important for people with lupus to discuss these practices with their doctor, especially if they're planning to use any type of supplement. It's also important to continue taking the lupus medications prescribed. Lupus is a complex disease, and no one with lupus should rely on complementary or alternative practices alone instead of the medication that they've been prescribed. So if you have lupus, here are a few tips that may be helpful for your journey. Focus on the future and what you need to do to get better. Don't look back. Sorry about that. That keeps going forward for me. Don't look back at what might have caused your illness and ask, why me? Try to incorporate some level of exercise into your daily schedule. Educate yourself about lupus and get involved with your own health care. And again, this slide just serves to show you that the Lupus Foundation of America is here for you. And again, we do have lots of different resources available. So thank you for taking the time to attend this webinar today. And I'd like to go ahead and turn it back over to Carla and give you guys a few moments to go ahead and submit your final questions.
Ashley, thank you so much for taking what I always consider a pretty tricky, not only diagnosis, but something that lay people such as myself really have a hard time wrapping my head around. What does a diagnosis of lupus mean? Where are resources? What is a reputable resource that we can turn to? So I can tell that not only do we have such audience participation, such great audience attendance, but great participation. So clearly everybody's agreeing with me. And I'll give everybody a moment to go ahead, as Ashley said, as Ashley said, to make sure you can submit any questions you may have by typing them into the questions section of your GoToWebinar control panel. I do already see a couple coming in. In the meantime, since I have everybody as a captive audience, I would want to remind you that NeedyMeds is also here as a resource. If you're having difficulty affording any of the medications or the healthcare expenses you need, please don't hesitate to reach out to NeedyMeds. You can visit us at needymeds.org or call our experts on our toll-free helpline, which is 1-800-503-6897. And of course, I'll have that contact information in the end. What you're looking at now on the PowerPoint slide are just a list of some of the NeedyMeds' most popular cost savings resources. So just a reminder that we're here to help as well. I also will take a moment to mention that as you participated in today's free webinar, we do our best to populate our calendar with other special topic webinars we think our NeedyMeds audience will be interested in. So we do hope you join us for some of the other upcoming special topic webinars in the next few weeks. And you could do that by, on the bottom right hand of the NeedyMeds homepage, you'll see a calendar of events, and you could click on the registration links there. I'm going to go ahead and put up, if my PowerPoint presentation will cooperate. There we go. I just want to make sure you have the contact information for the Lupus Foundation of America, and you can see the contact information for NeedyMeds at the bottom. So with that, let me go ahead and Ashley start asking you a couple of the questions are coming in. One, you actually did address and recapped it at the end when you did say make sure you get some exercise in, because we did have somebody saying, writing in, I do have lupus, should I be exercising? So I didn't know if you wanted to speak to that a little bit.
Definitely. So just like everyone else, people with lupus should exercise regularly or engage in some type of movement. And, you know, most people with lupus can take part in some form of activity. All exercise plans should be discussed with their doctor, and an exercise specialist or some type of trainer might be in order to help maximize results and minimize possible harm. Usually activities such as walking, swimming, bicycling, low-impact aerobics, and even certain types of yoga or Pilates will help strengthen bones and tone muscles without aggravating inflamed joints, as someone with lupus may have.
Fantastic. Thank you so much for being so thorough about that, because I think it's a really important distinction. If you say, you know, you can do some exercise, everybody's different definition of some exercise may vary. So I think pointing out, as you said, yoga or other things of that nature, that's really helpful. Another question coming in is, my doctor says I don't have lupus because I don't have the butterfly rash. Is that true?
So as I mentioned, that butterfly rash is probably one of the most easily recognizable symptoms with lupus, and a lot of people do associate it with lupus. But the truth is, it does not need to be present to be diagnosed with lupus. About half of all lupus patients experience that characteristic rash that may occur spontaneously or even after exposure to the sun, but not everyone does have it. And, you know, like I said earlier, this rash is so named because it does resemble that butterfly. But keep in mind that a diagnosis for lupus is going to be based on symptoms past and present, family history, as well as blood work. And you don't need to have all of those symptoms that were listed on that slide in order to be diagnosed.
That's really important. And you did just mention blood work. I have a question coming in about the importance of ANA, an ANA blood test in the diagnosis.
So the ANA stands for anti-nuclear antibodies, and it is the most common test that most people will talk about when it comes to diagnosing lupus. However, the most important thing to remember is that no laboratory test, even that ANA, can diagnose lupus alone. So again, those lab tests can't give that definitive yes or no because there's no single diagnostic test. Test results that may suggest lupus could be due to another illness, or sometimes they can even be seen in a healthy person. Also, test results may be positive one time and negative another, and different labs can also produce different test results. So again, back to that ANA test, that anti-nuclear antibody test. It's not specific for lupus. It can be positive in people with other illnesses, or even positive in people with no illness. So just because someone has a positive ANA doesn't necessarily mean they have lupus.
Wonderful. Thank you for clearing that up. And we have another question coming in, which is actually, I think a great way maybe to wrap up, because we are running out of time for questions. But this is a great one. My loved one has lupus. Do you have any recommendations for me?
Right. So I think it is really important that family members and friends be supportive of someone that has lupus. It's really important for them to have a great support system. So I would recommend familiarizing yourself with lupus. You should encourage your loved one to educate themselves about lupus, symptoms, and even know when to call the doctor. And it's important that you're understanding of their limitations and offer to help too. So knowing that not every day they're going to have a good day and they might need help getting some tasks done around the house. Carla, are you there?
I'm sorry, guys. I was talking, but I forgot to take my phone off mute. So sorry about that. What I was saying was that was very helpful, Ashley, and I think a great place to turn for somebody whose loved one has been diagnosed with lupus is certainly the Lupus Foundation of America, because of the tremendous resources that are available on that website. So please do keep that in mind. And I do have one other question I'd like to sneak in. And any other questions that we don't get the chance to answer for you, again, we'll follow up with you personally via email. But this one is coming in saying, what happens if you actually, some lab work shows positive for lupus, but the doctor says, oh, don't worry about it? What would you recommend a person do if that situation arises?
So, if your doctor is not willing to kind of listen to your symptoms and look at that lab work and, really be active in trying to find you a diagnosis and finding out what's causing your symptoms, I don't think that it ever hurts to get a second opinion. Sometimes finding a doctor is kind of like dating. It may take you a couple of doctors before you find one that's a good fit for you. So, I would really encourage you to be a self-advocate, continue to advocate for yourself and that there's something wrong, that you're having these symptoms, and document those symptoms and take them to your doctor. And again, if you need to, talk to another doctor, seek out, another opinion. You may also want to consider going to a rheumatology clinic or someone associated with a local medical school to you. But you really don't have to stay with a doctor that's not willing to be working with you in order to help you feel better in the end.
Great, thank you. And I think that really, we say that regularly at NeedyMeds too, that advocating for yourself is really the best thing that you can do. And I'm sure all of our audience knows that intimately, but the question is, how do you go about doing that? And I think a great place to start is with the Lupus Foundation of America. And we also hope that you do consider NeedyMeds as another source of support on your health journey. Thank you so much, Ashley, for taking the time to share your expertise with the NeedyMeds audience. And to our audience, thanks so much for taking time out of your day to participate in today's NeedyMeds special topic webinar, Lupus 101. If you have difficulty accessing those handouts in the handouts section of your GoToWebinar control panel, don't hesitate to email me after the webinar wraps up. And we do hope you join us for future special topic webinars. Thanks so much, everyone, and enjoy the rest of your day. Take care.